This program is brought to you by the Media Liberty Alliance Foundation in cooperation with OBBM Network TV, bringing citizen-led, creative local media to the forefront of local communities to foster a greater understanding of constitutional liberty and appreciation of what makes us truly free, starting with you and me.
Make sure to like and subscribe to the channel. That way you're updated each time fresh content comes out. And thank you for being part of the Zach Ratliff Show. The Zach Ratliff Show is brought to you by Mortgage Financial in Texarkana, Texas, Elmwood Custom Goods, and Church on the Rock, Texarkana. That's churchontherock.org. Welcome to the Zach Ratliff Show. I'm Zach. This is Dixie. Hi, Dixie. How are you?
I'm doing good, Zach. Thank you.
Yeah, thanks for coming in. This will be a little bit different from what we do, but in today's world, Dixie, you're a nurse practitioner. You're at Exceed Health Clinic here in Texarkana.
Yes.
But in today's world, it seems like medical costs have gone through the roof. And so you're trying to do something kind of like almost an old school throwback, right?
Yeah, going back to the roots of what healthcare really is.
Well, and so I'd like to get into that. And kind of my thought is, I have a family member that's paying $35,000 a year in insurance. I have my mom, who she doesn't live here locally, but she has multiple sclerosis. And so she does monthly IV injections and infusions. And so her medical costs are just through the roof. And so then when I see all this, golly, it'd be nice to just, what is throwing it back to the going a little bit old school on medicine? Can that alleviate some of the financial pressure that's around on this?
Healthcare is complicated.
Okay.
There's not one fix for all of it. Medications are a big expense to most patients. Sometimes that's more than what they can afford, and that's not unusual. There are grants out there for some of that.
Right.
But healthcare has gotten extreme, and part of it is, I'm sorry, greed and big pharma have done some damage.
Well, and so you own Exceed Health Clinic.
Yes.
And you were retired. So during COVID, is that what made you want to come back into it? How did all that happen?
Well, I was unhappy with the way people were being treated during COVID. Patients were dying alone. That should never happen with their family. I felt like we weren't getting the whole truth. Turns out we weren't.
Right.
I was an old disaster and trauma nurse.
Okay.
And so when they started talking about the N95 mask and how people, how everything, all that worked, all that was lies. I knew what was
just from life experience.
Just from life. I used to teach those classes.
Okay.
Back in my disaster and trauma days. So I knew. And I just wasn't happy. I think we could do better. And I'm a big fan of we deserve the right to choose what health care, what treatment plan we go on. I don't like forcing people down one path. If they choose another path, that's their choice.
Right.
And we were going to have to maintain that choice with our health care. And so I thought, well, I can make a little difference.
Right.
So what used to be Exceed Urgent Care was up for sale. I bought it, came out of retirement, and I gave people treatment options.
And so when you say treatment options, what does that mean? Because I don't know enough about the medical field I don't even know what I don't know.
Well, they weren't giving us many treatment options during COVID through Fauci and people like that.
Right. Which, when I got COVID, I just stayed at the house for a few days and got to feeling better and went on with it. It wasn't. I think I went one of my buddies is a nurse practitioner, used to live next door to me, and I'm like, hey, this is what I got. He called me in something, just stayed at home. He's like, yeah, just get better.
Yeah. So some people wanted to do what was recommended by the government at the time, and that's fine. That's their choice.
Yep.
Some people wanted alternatives, like ivermectin. I was one of the few who would write for it.
Right.
And that was challenging at that time because some of the big pharmacies wanted to report you.
Right.
But fortunately, I had some resources. So, and some people just wanted to do vitamins. I'll offer natural options.
Okay.
And during COVID, I gave out my personal phone number to everybody so they could call me if they got scared or something changed.
Right.
And I never had a single patient abuse that. And we got through COVID
Right.
very well. And like I said, people got options.
Well, and so when you say that you would write for ivermectin, and I know that was a big thing back then that they were saying it was, but I remember when hearing about that, I'm like, from growing up with my dad and my grandpa having farm animals and stuff, I'm like, I know what Ivomec is. But, that was so bastardized by the media into being something that was bad, where this has won many awards for being a drug that works. And so you were willing to write for that. But what I heard you say was you're willing to listen to how people wanted to be treated and make sure that made sense.
Oh, yeah. Some people were adamant they didn't want to do ivermectin, that it was just for horses.
Right.
And if they have that mindset, that's not going to work for them.
Well, then there was hydroxychloroquine or whatever, however you say that.
Some people wanted that. Some people wanted both. And I would give some that options if it was appropriate. And some people just want to go home and write it out.
Right, which you're looking at that, people. I mean, and luckily, luckily, I've always been in decent enough health to where this is just going to suck for a few days.
And it is just like the flu.
Right.
Is not fun for about 3 days.
No.
The gastro bug, 24-hour bug, it's rough for 24 hours. But we get through it.
I feel like I had a part of that when I've had COVID 3 times. Each time it's gotten less and less. Hard on me, but I mean, that's just what I felt like you were supposed to happen. Just natural immunity would come through that, but I don't know. I don't know anything about it.
It's going to differ with each variant that goes around, and how everybody responds, and everybody responds the same way.
Right. Okay. Well, so that makes so anyway. You buy the clinic in COVID, you get going. So you want people to be able to get the treatment that they need. So how does that evolve into what you are now, and what are you now? Like how does all this come together?
How does it all come together? Well, actually, I've been thinking about doing direct primary care for many years. Before I bought the clinic, I did a study years ago about healthcare in the Texarkana area and the underserved population, like the diabetics, hypertension, people that don't have insurance.
Right.
And they would go without medicines, without treatment, because they didn't have the magic insurance.
Right.
And I put the numbers to it, and I can treat people cheap with no insurance.
Right.
Way cheaper than insurance, and they can get the care they need. Most medicines, I can find medicines on the cheap list using GoodRx or the deals they offer at Sam's Club and get their medicines. There's options. But sometimes it's hard to get into the bigger clinics and facilities for cash because they really want a large amount. I can do it much cheaper.
Well, and tell me, and I could just have made this up in my mind. So tell me if I did. But I feel like a lot of times, especially as people age, it's like, oh, you need to come in here next week for this test, and then next week for this test, and then you need to come for a follow-up, and then you need to come for an office visit for us to read you your test results. Where if it's cash pay, it's like, we'll call you. Kind of like I had some blood work done a couple of weeks ago. What do you need to? I don't need to come back in. Just call me and tell me if I'm good. I don't need to pay an office visit. Just tell me over the phone. They're like, yeah, everything's good. Okay, thanks. Like I don't need, because I don't have insurance. There's nobody to charge all of those visits for. And I feel like that's what a lot of the medical industry has become. What all can we charge for and how many times?
Yeah, you're right.
Right. I felt like in my mind, I'm like, I feel like that's right, but I don't do it every day. I don't know that that's right.
Well, that's another place where we're a little bit different. I do what I call some big, large blood panels. It gives me a good picture. I call it my fatigue panel. Everybody complains of fatigue. And it involves a lot. And when I do that big panel, I'm going to bring my patients back in to talk to them.
Okay.
Because otherwise they look it up on their phone and something's out of line and they freak out. Blah,
right.
Blah. And not necessarily. I'm going to talk about the therapeutic ranges I want to see them in. So my cash patients, I bring them back in and I don't charge them for that visit.
Okay.
They're going to get 15, 20 minutes of me just explaining the labs and what our options are.
Right.
And that way they get educated and I don't have anxious patients and they really know what they're getting.
And so what a crazy concept. You're going to talk to people about what's going to help them the most and then come up with a consensus of how to treat that going forward?
Yes.
Yeah, man, what a wild world. Instead of, I remember I've had a few surgeries and stuff over life, and one thing my dad and my uncle always told me was like, they don't know if you don't know. Ask the question. So I'm bad about going, what's that word mean? Well, because a doctor will come in and says, I'm like, I don't understand that. You're gonna have to tell me in a different way. And then if I still don't, I will ask what and why until I have a full understanding. But a lot of times, and especially in some of the medical offices, you feel like they're trying to rush to the next person. And I understand there's some amount of time consciousness people need to have, but you're willing to say, hey, I'm not even charging you. Come in and make sure you feel good about and understand what's happening. Yeah.
It's important. And plus it's important to me. I was trained back in the day when they really trained nurses. Education was a big part of what we need to be doing.
Okay.
And so that's part of my patient education.
Right.
Everybody gets to choose. And then sometimes they choose poorly.
Right.
And 6 months later, when we're looking at it and things haven't changed, then we have another chat and they're like, oh, well, maybe we can try it your way, Dixie.
So yeah.
So it's a process.
Well, so let's kind of go through one of these things. It's been a number of months back. My daughter had a bad fever, and I watched her at 102. Tylenol. Then the next day is 103. Tylenol. Finally, we hit one night. We hit 104, and this is an issue. Mm-hmm. And but her primary care, couldn't get a hold of them because so I wound up going to one of the clinics, and a $10,000 medical bill is what I got hit with. Now I've negotiated that down because I'm not paying you $10,000 like that. It's just not going to happen. I will pay something, but it's not going to be $10,000. However, at that time, and they agreed, and we're on a payment plan, and I'm working on getting that paid off because, they had to cool her down. By the time she got back to the room, they had the air conditioner in that room, set down, but whatever. But what would I do if I'm one of your patients? What's different about you?
Well, for my members, they have my cell phone number, and they can call or text. Now, then I tell them, if you feel the need to call me at 2 a.m., you should probably go to the emergency room.
Right. Well, this was like 10 or 11 at night.
But so they contact me, and we come up with a plan. And a lot of times we can stay out of the emergency room. If I really feel like I need to see them, I don't live far from the clinic. I'll run up to the clinic, see them, do some tests if we need to do some easy tests. But usually we can talk them through it on the phone to get to the next day that I'm going to see them in the clinic. Or if it's real concerning, I will tell them where to go to be seen and get that checked out. So that's available, and that's included in the price.
And so what you're saying is you offer a membership at your clinic for people to have more of a concierge type medicine service for them.
Some people call it concierge. Concierge sounds too fancy for me.
Okay.
This is East Texas.
Yeah.
It's just care.
Dixie and them. Just call Dixie and them.
Yeah, just call Dixie.
Well, and so are the benefit of there's a peace of mind that comes with a member for this, then I'm guessing.
Yes, you're going to get in if you make an appointment. If you need to see me, you're going to get in 95% of the time that day.
Okay.
If you call at 4:50, unless it's an emergency, I'll see you in the morning.
Right.
But no, you're going to get in that day.
Right.
We try and work with patients on their medications to find them where the cheapest meds are.
Okay.
Because medications are frequently spent. I've got the cheapest lab prices in town. I negotiated with several labs to get my prices. I do the fatigue panel I told you about. I tell even my insurance people, I tell them, we can run it through insurance if you want, but they're going to charge your insurance $1,500.
Right.
I'm going to charge you $100.
Yeah.
So you get to choose, and I'll have them say, "Oh no, my insurance pays great." And then 2 months later, they bring me their EOB from the insurance, and the insurance charged them $1,500. I'm like, "Oh, so sorry."
Yeah, but I told you that on the front side.
Yeah, once it goes out the door, I have no control. So they learn, and but yeah, labs can be expensive. Medicines can be expensive.
And I've been talking to some people about you coming on, just kind of what you were offering. They're like, "Golly, we're just getting killed by insurance. We're just getting killed." So what does somebody have to do to become a member at Exceed Health Clinic? How does that work? Do they have to come in and get
Some
worked
people
up?
want to come visit with me and ask what's going on. That's fine. I don't charge for that either. And then you just fill out the paperwork and
Right.
and set up how you want to pay. The girls up front take care of that, and we're done.
Okay. It almost sounds too easy, Dixie.
It's just as easy as filling out an application to a gym. Probably easier.
Right. Well, some of us aren't big on that either, Dale. But you're just trying to make it more affordable for people to get quality care in our area.
Yes.
Okay. Well, I think that's what we needed. That's what I want to get out there. That's why I felt like bringing you in was just to be able to let people know there are options here. You don't have to be beholden to the god of insurance or the god of healthcare. Like you have options. You just might have to look for them a little bit. But.
And people are coming more aware. But just before I came here, as I was telling you, somebody had come in. They're concerned about the Affordable Care Act,
Right,
and what's going to happen with it, and that they might lose their insurance. And they were looking into things. They saw something about direct primary care on TikTok,
right,
and somehow our name got attached to that.
right,
And they came in. They wanted a pamphlet and information because we have different prices.
right.
We have like the basic level price. It's I think $60 a month.
Okay.
And that's all your visits are free. If you need to come in 3 or 4 times a month, same
Right.
price. Nothing changes. And then we have the one that's $110, and that's our top plan, but that includes all your labs.
Okay.
And at least 2 X-rays a year.
Right.
So some people go for that, and that's better for my people with chronic illnesses like diabetes that have to be seen more frequent. That really helps them out. And then we also have just a children's plan. It's $50, I think. And we're seeing more of that. That has
Right.
been surprising. The parents can afford through their jobs their insurance,
Right.
through whatever insurance they have. But it's too expensive for them to add the kids on.
Yeah, that makes sense.
And I also cover the kids. I'll include in their visit. They all have to have physicals for band or sports or whatever.
Right.
I'll do all that. That's covered under their membership too.
Okay.
And my guys that are DOT that are members, I do their DOT physicals as well for them.
Okay.
So all that's covered in the membership is easy.
Awesome.
And I have a lot of patients who it's easy for them. They just text me, Dixie, I need this medicine refilled. And it's just easy for me to do that on the computer.
Right.
And remind them, okay, but you do need to come see me,
Right.
when you get a chance. So, yeah, I do minor stuff like some sutures.
Okay.
I will get an occasional weekend call. Somebody's done something. And,
Right.
And for minor stuff, I'll go up there and tend to that. We do x-rays.
Okay.
Again, I have cash prices for those.
Which is great. My daughter had to get some X-rays from our primary care, not to and still the cash price on it. But that's the key. People don't know that you can even ask for a cash price.
Absolutely always pay for cash price. A lot of insurance say you want an MRI of your shoulder. It's going to be $1,800. And insurance isn't going to pay that, so you get to pay the whole $1,800.
Right.
For them to run it through insurance and apply it to your deductible.
Right.
I can get you the same scan for $450.
Right. Yeah. Well, that's what I was telling somebody the other day. I said, look, have you ever paid full price for a pizza? And they're like, yeah. I'm like, well, that's your fault. I have not. I'm going to call the pizza person and ask for a discount. I'm going to ask for a discount when I buy a truck. I'm going to negotiate the price on my house or if I'm your agent for when we're buying a house. I'm going to negotiate every price that I ever come against. Why would I not think I couldn't do that in healthcare? But for you, you're like, hey, we know this. Here's more affordable options. So you're making it easier for people to not feel uncomfortable with it just by providing a service at an affordable rate.
People have offered me negotiating options. I had one gentleman come in and offered me a half a cow.
Hey, that's worth it.
But I didn't know how to price it.
Oh, you call us. You do these two guys right here? We can tell you how to price half a cow.
Yeah, and patients bring me eggs, and in the summer I get vegetables. I like this.
Yeah, absolutely. Well, my grandmother's second husband, old school doctor out of Hope, and when he died, he had all this jewelry and liquor and all these things from where he had traded medical services for whatever people could. And then he told us it was there. He's like, look, this is what I took as payment a lot of times because people didn't have money, but I'd take a bottle of whiskey or an old watch or whatever. I mean, talk about old medicine. That's the way it really used to be. A farmer comes in, he gives you what he has, whether it's a half cow. And for those of you that don't know, you're not literally cutting it in half. It's a half of a butchered cow, which I don't know, probably $600 right now, I'd say, or more. I mean, okay, yeah, a lot more. I know at one point it was $450. You think 2,000? Okay, I mean, there's a lot to that. So
For half a cow?
yeah, because you're getting half the hamburger, half the ribeyes, half the rib. I mean, they're cutting it up and butchering it, and it's packaged and wrapped, and it's put in your freezer ready to eat.
Went for $2,000.
Yeah.
Oh, did I mention that if you pay for the membership for a year, that would get you 2 years? Half a cow.
Yeah, there you go.
And all your labs and x-rays.
For those of you that don't know, a friend of the show, Dale Holes, is sitting here off camera. So that's the person we're talking to. Say hello, Dale.
Hey, guys.
So there you go. Okay. Well, so anyway, this is an awesome deal. And let's kind of, I'd like to have you come back in and get some more info about it as we go forward. But I think this is something people need to know about, and people need to know is it's called direct primary
Care.
Direct primary care. And
I'll see ages 2 and up.
2 and up.
Yeah, so I see kids too.
Okay. Well, that's good to know. Well, Dixie, thank you so much for coming in.
All right. Thank you
All
so
right.
much.
Thank you, everybody. I hope God blesses each and every one of you today.